And let's get into our topic today. Okay, so we got a 72-year-old patient coming. The scenario is going to be having chest pain, irresolved, came to the emergency room, you did a troponin, and the word is equivocal troponin. So normal is about from 0.04, up to 0.04, 0.05, and he got around 0.05. You calculate the pretest probability, and that's around like 15%. So what's the next step we should do? That's the question he's going to ask you. Okay. Now, we have to, first thing we need to know, what are the most common answers people usually pick? What are the most common answer? Stress testing. That is the wrong answer here. We'll come back to it. And then echocardiogram. Okay. So these are the wrong answers. Most of the people, I think around 60% of the people is going to pick stress tests as the number one choice, but that is not the answer, okay? So let's look at our answer. The correct answer is CT angiogram of the heart. Okay. So this is the correct answer. When somebody with the chest pain at equivocal troponin right here, and the pretest probability probably like low to moderate, you always have to look at the sensitivity and specificity of a test. Okay, the two words I want you to remember: the pretest probability, and you should pick the test based on that. So in this case, in this patient having chest pain, it resolved, troponin is equivocal. Your answer is you do CT angiogram of the heart, which got a sensitivity of almost 99%, specificity of 89%. So pretty good test, okay? So that's the answer. The most common wrong answer is like stress testing. If the troponin was not equivocal, maybe it's a good idea you can do a stress test. But don't pick echocardiogram because unless you do a stress echocardiogram, you will never see like what's going on, is there an ischemia or not, right? If the regular echocardiogram is not it's going to tell you only about structural defect, or unless some massive thing going on in the heart. So don't pick those answers, okay? So the correct answer is you pick CT angiogram, and I want you to know the sensitivity and specificity of the CT angiogram is 99% sensitive, and specificity is 89%, okay? When you look at what is the sensitivity and specificity of stress test, like a nuclear or stress echocardiogram, it's around like, maybe around, I would say around 85 to 90%. Okay, so we got another good test, CT angiogram. That's the main point I want you to remember. Thank you so much for watching. God bless.